Hi, I'm the director and the founder of Common Knowledge Trust. We're a New Zealand NGO and have been since 1996, a year after I immigrated to New Zealand. I've spent the past 50 years in the childbirth conversation, so why am I speaking up now, really? Because I'm an old lady and I'm frustrated and have been for 50 years. There were two huge mistakes that were made in the 1960s and the late 1970s that I tried in my own little voice back then to speak up, and I tried to do that globally, and it just wasn't heard. And our NGO has worked since 1996 to speak up now. And so basically, we want to explain to you how you got here now with your breech baby and how this could be different now. Basically, I and our trust have failed miserably to get the message across. But this is a very particular time now, because what got put in place in the late 70s and 80s has now had a good long period of time to see whether it works. So if you see me sort of scrolling down, it's because I have notes in front of me. And so really what I want to say to you is it's really up to you. You're pregnant now. You're going to give birth now. You're going to have sons and daughters. What you do now and what you say to your sons and daughters in the next generation is going to be really important. And you have the right to understand this. Maybe not for your birth, although our encouragement after you listen to this is become highly skilled to birth your baby. But for your sons and daughters, that's really important. It's not just about how you birth them, it's how they birth their sons and daughters. And you have a lot to say about it, just as your mother and your grandmother, your father and your grandfather had in your life. So you have to birth now with the results of those two major mistakes that were made in the past. And your sons and daughters are either going to birth in this childbirth craziness that you're dealing with now, or we're going to change the concept or idea, the words, the actions, and the systems, and I'm going to talk about that. What I'd like you to do is think through what I'm about to say in this video. Make your own choices. Your baby's birth matters to you. And women, as women, have to support each other, and we have to stop the mummies' wars. We have to stop looking at our sons and daughters from a different birth lens. And we have to start to treat all birth providers as other women and men, and recognize that there are three roles in every birth. You, who are going to birth your baby, your other birth coach, who's going to help you do that, and your birth provider, who's there to safeguard the health and well-being of your baby. And we need to see birth as the highest level of any activity that any woman does. And every activity should absolutely be skilled, particularly one that is infrequent and is so life-transforming. If we saw birth as an activity, and we could have, that's what happened back then that I'm going to explain. But if I can convince you to see your birth as an activity that you have to do, it is absolutely essential for you to become skilled. It's important to you personally. It's important to your family and to the larger society. And we cannot be too busy in pregnancy to become skilled and then expect to take care of our children after they've arrived. They've already arrived. Your baby is here now. And you need to have a continuity of self that comes into pregnancy as a skilled adult, moves through pregnancy as a skilled adult, prepares for the birth of your breech baby as a skilled adult, and works through the activity of birthing your breech baby or head down baby or whatever, one way or the other, as a skilled adult. It's just really essential that you do this. You can't spend all your time just gathering information to make choices and not spend an equal amount of time to becoming skilled to do the activity. That just doesn't make common sense. But that's what the generation of women since the 1980s have done. You've spent heaps of time gathering information to make choices. So breech births in the beginning of time and around the world have always been normal. But we need to understand what the word normal is. And that really means when you take away all medical care, it's whatever might happen at a birth, and it could happen, but it may not happen. So let me tell you about why I'm the best person to talk to you about this. All of this has happened in my lifetime. I gave birth in 1970, and the last birth was in 1982. I lived through the changes. I didn't fully understand what was happening as I was living through it, but my involvement in childbirth has given me a huge ability to be perspective and to have hindsight. And I wasn't part of the natural birth movement. The families I worked with in the 1970s who developed the birthing better skills were just like you. You were just going to have a baby. We were all focused on each of us having our baby. We didn't really think about or care about somebody else's birth, and you don't either, really. And birth is not my politics. It never has been. I'm not a birth professional, nor am I anti-birth professional. I'm just a human being who happened to get stuck in this conversation, whether I liked it or not, because of something that happened in my life, which was to work with hundreds of families to develop a skills-based method called Birthing Better. So families came into my life, and they taught me that their birth was important to them. So naturally, what we did was to just see all births as being equal, and that's important. And I, as the director of Common Knowledge Trust, good name for the trust, we represent all births without exception. So right now, you are at the end of an evolution of childbirth from World War II. I was born in 1944, and it has gone onward into the modern maternity system ever since, and to how consumers view childbirth. And I was born at the beginning of that change. I birthed in one childbirth trend in 1970. I birthed in a second childbirth trend in 1982. And I moved to New Zealand in a third childbirth trend in 1995. So I have something to say about it. And I'm 76, and I am not going to cock it without saying this so that you perhaps can listen and change childbirth conversation for you and for your children's generation. So let me tell you something about post-World War II, because that's really when the modern world modernized. Just think about it. Really, there were no electric cars, no washing machines, no supermarkets, no indoor plumbing, and no central heating. And in fact, post-World War II, hospitals were just forming, really. And the obstetrical model hadn't started until 1952. So you need to understand that at the end of the Second World War, there were barely any antibiotics or immunizations. And there was barely any pain relief for the suffering in childbirth. But it was a time when massive population started to see themselves as upwardly mobile. So the OBs became a specialty in the 1950s. When I gave birth in 1970, there was a 4.5% cesarean rate. So that meant 95% of us labored. That was breech babies, twins, anything. And our labors were either good or bad. We either had a good outcome or a tragedy. We either labored for days, for hours or for days, and we either coped or we suffered. So when the natural birth movement goes back to those good old days when the cesarean rate was very low, their implication to you is that 95% of women had normal births. We did. What did the word normal mean? And that's really what's important. We did have normal births. And in 1970, when I gave birth, I knew people who suffered in childbirth, and I knew people who had poor outcomes. So you need to understand that a breech birth has always been normal. It's always normal. Every birth is normal. It comes at the end of pregnancy. And by far, the greatest number of women actually feel they suffer in childbirth rather than cope, because there's been no perception really that women can use skills to cope with the natural occurring pain of labor pains. Back then, in my generation, 1970, there were no ultrasounds. There was no constant fetal monitoring. There weren't very many lab tests. There was no way to deal with Rh negative or strep B or gestational diabetes. It was what it was. The risks included. So I had friends who were Rh negative and lost their baby. I had friends who had strep B and lost their baby. I had my sister-in-law's uterus ruptured because she had a classical cesarean when she was pregnant. She lost her baby. So you need to understand that back then it wasn't necessarily good about childbirth. It's just that there wasn't modern medical care to really reduce the risks. So how was a breech baby handled back in 1970 when I gave birth? We labored. We gave birth vaginally, whether it was hours or days, whether it was easy birth, whether the baby got stuck, whether our baby was alive, or whether our baby died. And doctors tried both external and internal version. In fact, I read some time ago that there was a Dutch midwife, I can't remember, 17th or 18th century, that thought it was abnormal for babies to come head down because humans walk on their 2 feet. So she did an internal version at full dilation on every single baby and delivered every single baby as a footling breech baby. So, weird things. Back then, in 1970, all women lay flat on their back with feet in stirrups. It may not be a gravity position, but get into that position, you're wide open. And by the way, hands and knees that have been advocated for the 70s, since the late 70s, early 80s, that's not an upright position. The only upright thing about a woman in hands and knees are her thighs. When women are on their hands and knees, they're in a horizontal position. It's actually almost no different from lying on your back with your feet up in stirrups. Your feet are bent as though they were in stirrups, and the only thing that's different is your hands are down. So lie on your back in a hands and knees position. It's a horizontal position. And this can cause your breech baby to bend in a way, cause any baby to bend in a way that might hinder the birth. And that's what Birthing Better Families actually discovered, is that positions do matter, but we need to be able to read how our baby's responding to the positions we're in. High forceps were used back then if the baby was not in the pelvis, above the pelvis, or mid forceps if the baby was in the pelvis, or low forceps for a baby that was stuck in the vagina. Doctors knew back then, they know now, that if a woman is tight on the inside of her body, that this can hinder birth. And this is what Birthing Better Families discovered and why we developed skills around it. And why our trust and what I've done for 50 years has been passionate about us being skilled. But I'm ahead of my time, so let me just go on here. If they needed to use forceps, we had an episiotomy done, often through the rectum, 4th degree, and sometimes laterally as well. So that's how a breech baby was handled back then. And in the United States in 1970, there were no midwives. It wasn't legal. There were a lot of Vietnam paramedics that came back to do home births, obstetricians, lay midwives, labor and delivery nurses. A lot of religions had home births. That was what they did. There were a lot of religions in the United States that would never go in to the doctor because they wouldn't accept a blood transfusion. So in 1970, also what was happening to all of us 95% who were going to deliver vaginally, was the first ever childbirth preparation classes. And they were all skills-based, Lamaze, Bradley, and New Zealand, Grantley, Dick Reed. And yet, and this is where it took me a long time to understand this, because I birthed in 1970. My husband and I went to a class. There was a very high societal expectation in the United States that we all attend the first childbirth preparation classes, and the Lamaze was basically taught in every hospital throughout the United States. It's just what we did. We went for a 6-week class, learned skills, and went home and practiced. So, and Bradley was called father coach or husband coach childbirth. That was more considered to be upmarket. And that was definitely more targeted to natural birth, although these 3 obstetricians targeted low-risk women. But everybody was taught it. But we always had in the back of our mind that those skills were for people having a low-risk normal pregnancy. And because 95% of us labored, even though we had risks, we were all sort of considered to be normal back then. Risks were considered to be normal back then. And we had no choices. Cesareans in 1970 was major abdominal surgery, and it was used only really to save a woman's life. If a baby died, they accepted that because there was no birth control, so we'd have more babies. We had rubbers and eventually the diaphragm. We didn't have a pill. We didn't have abortions. So women got pregnant. They cut us from our pubic bone to our belly button. And we were only permitted to have 2, maybe 3 pregnancies because a ruptured uterus and labor really did happen. And it was serious. Mother didn't always die, but often the baby died and often a woman needed a hysterectomy. So that was like 1970, my lifetime. Right? So you need to wake up to how you got here. So the natural birth movement actually formed somewhere in the 1950s. It was the post-World War boom of modern people, right, and modern maternity care. So there was a belief, rightly so, we understand this, that low-risk normal pregnancies and birth were being brought into the medical system for all the standards of care, all the assessments, monitoring, and procedures. And people were asking, why are they doing that? If it's so normal, why are they doing that? But the question was, how do you separate normal from high risk? And that has always been, it's still a dilemma. Having a breech birth is normal. The chances of something happening to your breech baby is minimal compared to you dying in a car accident or dying of cancer or having a heart attack sometime in your life. But it's there and it's real. So separating risk from what's normal has always been a dilemma in childbirth. Now, there's a woman in the UK called Marjorie T.W. I heard her talk in 1982, and I'm going to bastardize what she said. She looked at risk factors relationship to home births and basically said women can have high number of risks and have very successful home births. So here's the bastardization of it. No matter how much risk you have, not necessarily your baby, how many risks you have is totally unrelated to how well you cope with labor and how easily your baby gets out of your body. They are not connected. They are not connected. And that's where it becomes really, really, really complicated. So in childbirth, there have always been 2 elements. The one element is women suffering. They haven't coped. There's been no perception until the 1970s with Lamaze, Bradley, and Grantley Dick Reed that women could use skills. Traditional cultures, if you look into traditional cultures, they had skills about what to do and not do in pregnancy. They had some skills. Rebosas were used, but that's not a skill a woman's using. Squatting we'll discuss in one of the lessons. So what are the skills? Women don't have them. I've been in multiple traditional communities. Women have what to do and don't do in pregnancy, what to do and don't do after the birth, but most people just accept birth for what it is. You never know what your birth's going to be like, and it is what it is, right? So there are these 2 elements. One is suffering, and that's what you used to hear, isn't it? Women suffered in childbirth. It didn't mean there was a problem. It just meant they didn't cope. And then there were the potential issues or risks that might become a problem. And a breech baby is a normal birth, normal pregnancy, normal birth, that may have a risk factor to it. So how do you deal with either suffering or risk factors? So what Lamaze and Bradley and Grantley Dick Reed did was they said that if women who are low risk could use skills, then they could produce a natural birth, pain-free labor with no medical care. So in other words, Lamaze and Bradley and Grantley Dick Reed believed that skills could help women cope, but they targeted women who were low risk. And their goal was a natural birth, pain-free labor, and no medical care. And it took me years to understand that that was the huge mistake. That was the first huge mistake. Huge mistake. And that goal has carried over to today. And that's still the goal. That whatever women are doing, their goal is to have a natural birth, pain-free labor with no medical interventions. That's still the goal. So that's one path, and you are living at the end of that path. And we started back here on what could have been a different path, and that's what we're trying to tell you now. So the true and broadly achieved goals. So when in the United States, there was a high societal expectation that we all attend childbirth classes, and we attended the Lamaze classes, even though we knew that they were targeting this low-risk women. That what happened was that there was really a goal that was achieved that people really didn't pay attention to, and we should have paid attention to. And it's the same goal that can be achieved now, which is that every woman can use skills to birth her baby. And that's what's really important. So if we separate out natural birth from all birth, then we are focused on ripping apart this fiber of a reality, which is 100% of pregnant women will give birth one way or the other. And it's always an activity that each woman would do. So what happened in the United States was that care providers, labor and delivery nurses and obstetricians, saw multiple millions of women in the 60s and 70s who were for the first time coping with the natural occurring pain of childbirth by using skills. And that occurred over a 30-year period, a generation. So you need to understand that the goal of Lamaze and Bradley and Grantley Dick Reed was targeting the women who were low risk. 95% of women birthed whether they had a risk or not, labored whether they had a risk or not. And the goal was to achieve a natural birth, pain-free labor, with no medical interventions when we were all birthing among the standards of care and the evidence-based practice of the day. And what they saw was not more natural births or more pain-free labors. What they saw was more women coping. So the wrong goal was set to begin with. So if Lamaze and Bradley and Grantley Dick Reed had just said 100% of pregnant women are going to give birth, you're one of them, you should have skills to cope and manage, deal with, work through, handle, stay on top of, feel in control. And because all of them wanted fathers to be there, the fathers should have the skills to help you achieve that coping. So birthing better started to develop in the early 1970s. It didn't develop because I had a passion for birth. I just sort of stumbled into it because I was a body worker and I was working with pregnant women and women my age whose bodies had been damaged from birth. And so the first thing that we, the fathers and mothers who developed Birthing Better, did was we focused exclusively on better skills for coping with birth for everybody, because they represented everybody, not just low-risk people. And they knew that they were going to labor. And they didn't want to be burdened by this perception that they had to have a natural birth or a pain-free labor with no medical care. Some of them were never going to go to the hospital because of their religious beliefs. Others of them couldn't wait to get into the hospital because of their religious beliefs. And most went to the hospital because that's what you did, and some labored at home. But wherever they had their baby, whoever was present, whatever their circumstances, belief, then we didn't have much choices, but people were still making choices. No matter what happened to and around the birth, from the beginning, Birthing Better families developed skills. Fathers and mothers alike developed skills so they wouldn't suffer in childbirth, that they could work through the natural occurring pain of labor and get through birth. So we didn't think we needed more back then because the cesarean rate was 4.5%. But something happened in the beginning of the 1980s, the mid-1980s, where the cesarean rate started to rise. And it started to rise by a number of things that I'm going to talk about. But it began to rise because one of the issues and risk factors that were becoming to be understood as problems, and for long first and second stages where women suffered. So there was better diagnosis, and there was a huge risk aversion by modern women who were demanding that the medical profession do something about any risks that they had in their pregnancy or birth. Women who were Rh negative didn't want their babies to die. Women who had breech babies felt that their baby was at risk because some babies had died or developed cerebral palsy or had other problems. Some women's bodies were just torn apart through birth, through forceps, through a baby coming down a tight body. So modern women demanded that the medical profession respond to them because that's what being upwardly mobile is. So in the 1960s, that was the time where these two pathways could have existed. The pathway you're on now, which is natural birth, pain-free orgasmic birth at home with a midwife and water, trusting your body, saying no to medical care, having a breech vaginal birth after a cesarean or in all sorts of situations. Back then, when Birthing Better, it's because we saw that skills helped women to cope. And so we worked on developing better coping skills. So if that had started back then, your mother and father would have told you and your partner that it's natural and normal to learn birth and birth coaching skills in your pregnancy and use those skills to birth your baby. That's what they would have told you. But because the path you're on existed, because the change in the natural childbirth movement from the 60s to the 70s changed, then you're at the result of that change. So that's important. So what happened was in the early 1970s was that not enough women had achieved those natural births that were advocated through the skills-based method. So the next group of the famous authors that you know about started to focus on choice. Birthing Better has always focused on the process, not the outcome, not the type of birth, but our ability to skillfully work through our baby's birth journey that leaves all of us empowered when we've done that. Instead of an outcome, oh, I had a cesarean. Oh my God, I'm never going to recover from what they did or didn't do to me. So you need to just remember that in 1970, a cesarean was rarely, if ever, done for a breech baby. A breech birth was considered normal, but people recognized risks. And what I said before was how breech babies were delivered. And women, even today, still want to reduce the risk. You're still trying to reduce the risks. You're just doing it a wee bit differently. You're trying to reduce the risk because you've been told by people in the natural birth movement that there's an ideal position for your baby to be in. And you're looking for that skilled birth provider. So you're still trying to reduce that risk, but to have that normal birth. And so we need to think about this together. So what actually changed? Why did the cesarean rate back then come to be where it is now? Because you're dealing with that. And the reason is, and because I lived through this, consumers put pressure on the modern maternity system. There are some authors who say that doctors wander around with knives ready to cut us open. That's never been accurate. That has never been accurate. We, as modern consumers, have always wanted our lives to be easier. We want running water in our house. We want indoor plumbing. We want refrigeration. We want instant hot water and heat and air conditioning. We go to the pharmacy and get things for the smallest aches and pains. And the professions respond to us. So we, as consumers, wanted to change what was happening with cesareans in different manners. First of all, we didn't like being cut from our pubic bone to our navel because we started to wear bikinis. That's why it's called a bikini cut. They didn't do a low-lying cut and then bikinis got developed. We wore bikinis and didn't like to have the scar. That's why they do keyhole surgery now for appendix. People didn't like the scar. So the medical profession responded. We also wanted fathers to come into a cesarean. We had been given general anesthetics. And they could come into a labor and delivery, but they couldn't come into a cesarean. And we didn't want a general anesthetic anymore. So we advocated, we demanded to reduce the risks of our babies. And the medical profession responded, and we wanted to improve the experience. And this is what has always separated the first world from the third world. So modern education and modern healthcare systems are often the first things that people in undeveloped countries want and is delivered to them long before they have running water, indoor plumbing, electricity, or roads. So consumer pressures on all forms of healthcare. It's created a lot of modern medicine. I mean, if you go to any grave cemetery and look in the 1800s, early 1900s, childhood diseases wiped out 20 to 30% of children around the world. We died of diabetes, high blood pressure, cancers, heart conditions, typhoid, yellow fever, diphtheria, penicillin, pneumonia, TB. So we demanded not to suffer, not just from pain, but we didn't want a long labor. We didn't want to be sick. We knew there were problems with breaches and twins and other things, and we didn't want our baby to be at risk. So we demanded change. So what else changed, right? Back then, in 1970, there was hardly any birth control. And women weren't going out to work, so if we had a dead baby, we were told, you'll get over the tragedy, have another baby if this one dies. And by and large, we did. There was no pill. I grew up with rubbers, and then later in my life, diaphragms, and then IUDs, then the pill. And then we went to work, and we wanted fewer babies, and those babies were more precious. And that's why things changed. The natural birth movement of the 70s, however, didn't see it that way. They believed that the medical profession was out there to get women. And all the famous people. And they stuck to those three goals. And that began those mummy wars. Natural versus medical birth, home versus hospital, midwife versus doctor. You know it. Breastfeed, bottle feed, go to work, take your child to a daycare center. It's all the mummy wars that women impose on each other. So those three goals that Lamaze and Bradley and Grantley Dick Reed advocated, even today, with all the choices in the world, women are not having more natural births. But skills do. They produce women being able to cope. In spades, women stopped suffering in childbirth. And that should be at least the first goal, rather than a type of birth. So we were the first generation of women seeking a vaginal birth after a classical cesarean. So birthing better families absolutely know how to prepare our body for birth. And we were always asking this question, hey, what about me? Or what if? So we first, from the early 70s to the 80s, just worked on coping skills because the cesarean rate was so low. And once the bikini cut came in, and spinals and epidurals rather than general anesthetics, and the lower risks, the ultrasounds, the fetal monitor, all when that came in, and women were demanding that they were put at less risk, then we started to develop skills to how to prepare our body. So we didn't actually know that anything that we were doing could really make a difference, because you never know what your birth's going to be like. So none of us had any expectation that preparing our body for birth could change birth. Women just didn't want to have and didn't like having long labors or having a baby having trouble coming out. So we started focusing on opening our body and coping better. And this is where fathers in birthing better were just absolutely exquisite, because they get it. Exercise and plumbing, big object has to come out of a container. Show me what to do and I'll do it. So just practical skills, not a philosophy. If you, carrying a breech baby, have all the choices in the world, you still need to prepare your body to let this big object out of your body. If you do that, your baby will come down easier. You're less likely to have more medical care if your baby comes down easily. And you're less likely to scare the men and women who are trying to help you and protect your health and well-being if your birth just moves forward and none of the risks seem to be coming forward as problems. So as we were developing a skills-based method, always remember this, because back here you started on this trajectory of Lamaze, Bradley, Grantley, Dick, Reed, and it was all about skills, but skills didn't achieve those three goals sufficiently enough. So the natural birth movement said choices, and all childbirth changed to information. And that's what women were, and that's why they don't go classes anymore, really, to tell you the truth. They can get it all online. And it's boring, right? Every little thing, what was the pros and cons? Write a birth plan, make choices. It's now a consumer model. And we still stayed down here on this other path. Skills, 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 skills. 100% of pregnant women will give birth. You're going to give birth. Learn skills. You and your partner can have a common set of skills that you use to work through your baby's birth, no matter where it takes place, who is present, what your beliefs are, whether you love it or hate it, or what happens. Any birth that you have with your baby is worth you using skills through that time it takes to birth your baby. That's what we want to tell you. It's your baby's birth. We got pregnant to have a baby, not a type of birth. So skills should always be fundamental to pregnancy and every birth, without exception. So that's where the split is more pronounced. Childbirth is choices, were skills. Great if they would marry up. But when I gave birth, we had what were called assessments, monitoring procedures. And that's what they were called. Assessments. They assessed us, whatever they did at the time. They monitored us in whatever way they did it. They had procedures when they felt they needed it or felt that those were the standards of care. But by the 1980s, the natural birth movement had called them interventions, with a strong implication that they were imposed and unnecessary. So now, if you make a list, if you just make a list, you can stop this now, make a list of what you consider to be interventions. What are they? Ruptured membranes, being induced, being augmented. Let's say you just stick to 3 of them. You have to avoid all 3 of them to be considered to have a natural birth. Do you know how insane that is? But if you keep going down that list, and we have, our trust has, we've asked hundreds and hundreds of midwives, childbirth educators, and women, what they consider to be interventions are. And they come up with a short list. The short list is 20 different things, right? So you have to avoid 20 different things in order to achieve this ideal of a natural birth. That's insane, right? That's insane. Why should any birth, why should your birth be defined by any medical assessment, monitoring, and procedure you have or don't have, like or don't like? Your birth can be as empowered as you want, particularly if you have skills to birth your baby. You may not get the choices. You may lack the choices. Your choices may change. You may get exactly what you want but hate it. But you have to do the activity of birthing your baby. So focus on doing that and have your partner or other focus on helping you do that. So you cope and manage, work through, deal with, handle, stay on top of, and feel in control, no matter where you birth, who's present, what happens, or your beliefs. Every birth can be empowered when every woman and man uses skills to birth their baby. So what was seen as successful back then, what should have been seen as successful, was considered to be unimportant, and it was minimalized. So all of us, multiple millions of women who coped in my generation, our births were minimalized because we did not achieve those 3 goals of natural birth, pain-free labor with no medical care. But our generation of women and men have very empowered, positive birth memories, because even though the skills weren't the best, they were something. We had something to do and something to work together as a family. And us, our generation, changed childbirth for you guys, because our behavior, the way we coped and managed, calmed down the men and women who were birth professionals. They didn't see as much suffering. So the natural birth movement, it was set up sort of like the natural birth movement and skills, but about choices. It was to say no to medical care, isn't it? It's not say yes to medical care. But why shouldn't it be? There are plenty of women who love medical care. That's what distinguishes them from being sophisticated, modern, respecting professionals, reducing the risks to themselves and their babies. So really, the childbirth movement that became information, it was all about women who were low risk having choices to say no to medical care. So where did that leave all the women that were high risk? It left us out, the same way as it left us out at the beginning, because our births were not brought into this concept of everybody should be skilled. It was for low-risk women achieving those 3 narrow goals. And because we shifted to this consumer model, you are seen of in the choice-based system as a consumer of medical services. And that service should provide you with what you want. And this is nonsense. No, they shouldn't. Because you might know what you want, but that isn't necessarily how birth is going to unfold. Babies don't come to plan. In the tens of thousands of women I've talked to worldwide about childbirth, I would say not one of them ever said to me, I had exactly the birth I envisioned. 99% of them said it was nothing like I imagined. Right? And that natural birth model stretched into other areas of life. You know it. The breastfeeding versus bottle feeding, not working versus staying, going out to work, natural diets versus conventional food, the medical versus natural, midwife versus obstetrician, home versus hospital, sleeping at night or getting up, daycare, stay at home, or what women said about their children. I've had birth professionals say to me for years, women don't say anything to their children about birth. Oh, yes, they do. And this is what it sounds like because of this arc that you're sitting on now. And you may even find yourself doing it in your life with your children. He was my hospital birth. He was my induction. She was my home birth. It was wonderful. Do you understand how nuts that is? It's nuts. And you have a choice to change this. When you use skills to birth your baby, are you going to necessarily have a perfect birth? No, of course not. But you're going to put your effort in to working through your baby's birth journey. And what you're going to say to your baby afterwards is that I use skills to bring you forward into life, whether it was on the way to the hospital, being prepped and in surgery, or birthing at home alone. I use skills. Your father and I, your aunt, your grandmother, your friend, whoever, we use skills to work through your birth journey. You might say to them, I could have used my skills a bit better. I would have breathed a little bit more consciously. I would have relaxed a bit more, things like that. But you would never sit there and say, oh, he was my cesarean. Oh, she was my home birth. So with choices available to you and birth plans galore, there's continued to be a rise in the increase in cesareans because the skills-based trend did not go along because the natural birth movement poo-pooed it. And you know that from reading all of them. Birth's instinctive, it's natural, women just know how to birth. No, women birth because they're pregnant. It doesn't mean they know how to birth any more that you became a good lover just because it was instinctive, or because your baby knows what foods are safe to put in their mouth just because they're hungry. Childbirth is going to happen to you. It's an activity we do. We can be skilled to do that activity. So this is what you want to understand of the two paths. The system that you're living in now is a choice and a birth plan. That's your goal. It's like planning a wedding and not having to have a good marriage, or choosing what car you want, but without learning to drive. There is just this huge shame, blame, guilt, disappointment, anger, frustration, which is lasting a long time in women's lives. And it impacts our children and our families and our societies. But skills is always a process, not an outcome. Every woman and man can be empowered by using self-actions or skills. That's true your life now. Childbirth is empowered by our self-actions. And the self-actions are the person who supports us. We are empowered by using skills, even if it's not perfect. We have pride in our self-capability. We're become ready to parent. We leave birth behind. And we have very little shame, blame, and guilt. So today, as you face your breech birth, you have choices. There's more of this opposition. And I read it in these Facebook pages for breech support. Oh, I don't want a cesarean. I want a vaginal breech. I had one. You didn't. Too bad. Great birth. Wonderful birth. It's just that, right? And what you're doing on these breech Facebook forums is you're trying to get your baby into the right position, right? And you're struggling whether you want to have a vaginal birth, or whether you need to have a cesarean, or whether you have choices or don't, whether your care provider can help you or doesn't support you, whether to be at home or in the hospital. Can you find a skilled birth professional? Or what happens when she's working with an unskilled woman who's making choices? You're trying everything to turn that baby, Webster techniques, spinning babies, homeopathics, acupuncture, good thoughts, doing everything. It does work. No, it doesn't work. There's more anxiety. Only one type of birth is now considered to be valuable. A cesarean isn't considered to be a birth. And this we have to change, but I can't change. I'm not going to have any more babies. So what can you do now, right now? Become skilled. There are many skills-based methods. Just commit to using skills throughout your baby's birth, no matter what kind of birth you have. It's your baby's birth. Just become skilled. So I want to answer what the difference is in the skills, because a huge number of women on the Facebook breech forums are using heaps of skills. Webster, homeopathic, spinning babies, acupuncture, heaps of skills. But your baby is either turning or not. And you're either having a cesarean or a vaginal birth. And there's either a problem or there isn't. But because we lack skills, because those skills didn't develop back then, because birthing better couldn't get our message across, and because I've failed in 50 years somehow to do this, you do not know the shape of your pelvis or the shape of your uterus. You don't know whether you have weak belly or uterine muscles, or whether you have a septum in your uterus, or whether the placenta or the cord is an issue. You don't know how to create space and open up for your baby and soften your internal tissues. And you don't know which positions your baby is going to like compared to the positions that you've been told to get into, paying absolutely no attention to whether those positions hinder or help your baby. And that's what Birthing Better families did. Did other skills-based methods do that? Don't have a clue. Haven't followed them. Okay? We've only focused on what we do because we know that whether our breech baby turns, whether our breech baby is a double footling, single footling, compound breech, comes down with its arms above our head or not, whether the head gets stuck or not, whatever it is, if we get our body prepared, if we know the shape of the hard tube, the pelvis that our baby's trying to navigate through, if we get into positions that keep the labor progressing rather than get into positions where the labor slows down, if we can do all these things, we are more likely to have a safe birth, whether we have lots of medical care or not. And we're much more likely to be looking and sounding like we're coping well, even though it's progressive and can often be very painful. And our behavior, how we cope and manage, how we're behaving, not like good little girls, but we're behaving like skilled women, then the women and men who are birth professionals and our partners and others who are with us are less stressed. So you're doing everything now to get your baby into that perfect position. But there are head-down babies that have problems. There isn't a perfect position. It's the relationship of this object in your body. So you're not learning how to open your body to give your baby room, or how to soften inside so your baby moves down, nor the positions that keep labor and delivery progressing. So you can't couple those skills with what's happening right now. And you may not for your birth. And there's no shame, blame, and guilt about that because you didn't know what you didn't know. And you weren't looking for what you don't know. And nobody is telling you. And for 25 years, I've shut up because I got sick and tired of people screaming at me in the natural birth movement, the home birth midwives. Honestly. So had both of those paths evolved at the same time, if we had publicly, evolution of the Lamaze and the Bradley and Grantley Dick Reed, if those skills had evolved the way that Birthing Better had, and choices had been coupled for any type of birth, then all of us would have better births, whether our choices unfold as we want or not. And nothing more, you would have skills to cope with the natural occurring pain of labor, or skills to work through your baby's birth if it's an unplanned cesarean while you're being prepped and lying on the table in surgery, or driving to the hospital being prepped and having surgery. You would have a mindset that said, this is my baby's birth. I am going to skillfully work through this birth journey because it's my baby's birth. So let's talk about birth providers for a minute. They're men and women. They're your mothers, your fathers, your wives, your husbands, your partners, your brothers, your sisters, your daughters, your sons. Right? They do not owe you anything. They're doing their job within the evidence-based practice of the day. They are there with their skills to safeguard the health and well-being of your baby. And if you are not skilled, you're not doing that. And don't take this as shame, blame, and guilt, because what you don't know, you don't know. But even if you don't get skilled for your baby's birth, Learn skills and then tell your sons and daughters they should become skilled. Or tell your friends or your sisters and brothers. So if you're skilled, you make their job easier. They know, you know there are risks to a breech birth. But if it's easier for you to get your baby out of your body, then the fact is there's less trauma and drama. Have you made a skills-based birth plan that tells your birth professionals, whether it's midwives or a doula or obstetrician, what skills you are learning to help reduce any or prevent the risks that you could have with your baby? Do they know? Most birth professionals are very frustrated by birth plans. They don't actually know what you want, and you don't either. I can't tell you how many women make birth plans that unfold fairly well and they're still pissed off, or they didn't get 1 thing out of 10, and that irritates them. So if the bottom line for you is a breech vaginal birth, then how do you see yourself being able to cope and manage with the natural occurring pain of labor, which is the harder part? How do you see yourself getting into the best positions to help you get that baby out of your body? So the natural birth movement, what you've been told since the 80s, what I've been told since the 80s, is however a woman wants to behave in labor is fine. No, it's not fine. Women do not want to suffer in childbirth. They do not like feeling out of control. When you see women moaning and groaning, they're telling everybody around them, plus themselves, I can't cope. And when partners and birth providers see suffering, they want to help. And we as birthing women, when we're not coping, we want it over with. So we have to change everything that we're saying to one another. So if we're skilled, and this is our experience as birthing better families, is that birth professionals were much more likely to negotiate with us. There's no general generic problem. We have specific issues that may become a problem. So if we are behaving well, that doesn't mean being a good little girl. It means like we look like we're coping and we're managing and we can talk to them and we can stay on top of it and people are relaxed in our sphere and everything is looking okay. Birth professionals were fine with letting us continue, even if there were issues and risks that become problems. Because if everything is looking fine, it just was fine, and we kept going. If we stopped coping, if we looked stressed, if things started to happen and we looked stressed, we were more likely, much more likely to have more medical interventions and end up with another cesarean. Particularly when we prepared our vagina. That soft tissue in us can stop a baby. That's the time when the baby is at most risk because it's moving from being a placental fed to a breathing human being. Now, there are people in natural birth field that said, leave the cord attached, the placenta's feeding it. You don't know if the placenta is still attached or functioning. And the hemoglobin no longer has the 2 oxygen molecules as the baby's coming through the birth canal. It wants to breathe. So you want your birth canal to be open like a lotus. You don't want the baby delayed. You don't want it stretched. You don't want to be damaged. So where to from here for you? Each of you have a choice. You can keep this present dysfunctional childbirth trend going into your sons and daughters' generation, where only women who have a natural birth are valued and praised, or you can change the present childbirth trend to include all births as being empowered and skilled. So let me explain to you as we wrap this up, because this has been a long talk and I get this off my chest. Change comes from ideas first. So Lamaze and Bradley and Grantley Dick Reed and the natural childbirth movement from the 1950s and the midwives who were doing home births in a lot of countries, they had an idea, and they were partly right. The idea was that modern medical care was just bringing everybody in pregnancy and childbirth. So they wanted to separate the low-risk women out, right? That was their mistake. It was just 100% of women. But you can understand why they wanted to do that. So they wanted low-risk women to have this natural birth, pain-free labor with no medical intervention by using those skills, rather than seeing, so their idea was not all women, they're all giving birth. So it was never about including everybody. So ideas matter, and you are still in that idea that the goal is natural birth. The goal is for you to have a natural breech birth without being induced, without having a lot of vaginal exams, without having birth augmented, without episiotomies. Those are the things that is that ideal breech birth. But you'd accept other things, for sure. So when ideas form, words follow that. So in that trend that you're still in, there are phrases like pregnancy and childbirth or normal life events that rarely require medical care. But the word normal then is either never defined or it's defined very narrowly to mean good and easy, able to cope rather than anything that could happen might happen. That what you're being told is birth is instinctive. You'll know what to do on the day. You breathe all the time. Cows and cats aren't taught to birth. You don't need to be. Right? You just need to say no to medical care. Why? What if you want it? Should your birth be less empowered? The only true birth is one that has no interventions, no medical care. Why? Why isn't a cesarean a good birth? Why do women feel disappointed? There are women who have labored who have hated it. Hated it. Their whole life, they feel damaged by traumatic labors and vaginal births. Why? If we had skills, we'd still feel trauma, but we would have used our skills to work through those challenges. That matters. So when you have ideas and you have words, then there are actions that are taken. And in the present childbirth trend that comes from back then, the actions were make a birth plan. Say no, not yes to more medical care. Say yes to home births with a doctor hours away who's a skilled breech birth person. Fathers are no longer birth coaches. They were told, don't coach a woman, be a support person. There's now the politics around childbirth. It didn't exist in 1970 when I gave birth. And there are now birth groups, breech birth groups, VBAC breech births, multiple VBACs, home birth groups. We're tearing each other apart, them versus us. And when you have actions and words, and from an idea, you put systems in places. I'm in New Zealand. New Zealand has a New Zealand midwifery model of care, which came from that. It's on steroids. Has it worked? Parts of it are very successful. Other parts are dismal failure. And primarily because they do not see the necessity in their partnership model of women being skilled and fathers being skilled to work through the activity of birthing their baby. They consider to be pregnancy and childbirth as normal life events that rarely require medical care, but they go to school for 4 years. Why is that? Well, just in case. So shouldn't women and men be skilled just in case the lack of skills mean that they don't cope and that they may put their baby at greater risk because they don't know how to get their baby out of their body? So the systems that were put in place that you're dealing with is that there are birth methods. There are lots of very good ones, but they're all focused on those narrow goals of natural birth, pain-free labor, with no medical care, and using techniques like you're doing to try to turn your baby. And their goals were very specific. Natural birth, pain-free labor, home birth, birth with a midwife, orgasmic birth, water birth, no medical care. So if this other path had come along, there was an idea That idea was 100% of pregnant women will give birth. Those were the words. And they'll give birth one way or another. And every birth is an activity. And every activity is best done with skills because humans thrive on being skilled. And every birthing woman and other person can work together with shared skills throughout their baby's birth journey. Those are the words we need to use. We get pregnant to have a baby, not a type of birth. It's natural and normal that we learn birth skills in pregnancy and that we use the birth skills to birth our baby. Those are the words for this idea. And the actions are find a skills-based birth method and learn the skills. Create a skills-based birth plan and have your skills listed in your notes so any birth provider can refer to them and encourage you to use them if you don't look like you are and praise you when you obviously are. And then the actions you take is work through your baby's birth journey, whether you get the birth you want or the one you absolutely hate. And what's the system of this skills-based method? That every birth professional out there, every birth worker, every birth provider encourages all their clients to self-learn birth skills. And that they give every client a handout of skills-based methods that they can choose from. And that they notate every skill a woman is using in her notes from 24 weeks onwards. And that if you're at that birth, you praise mothers and fathers for using their skills. And you encourage mothers and fathers who don't look like they are and feel like they're not coping well. And what is the goal? That every birthing woman and father or other can feel empowered by using skills. That 100% of pregnant birthing women and coaching supportive fathers and others can be empowered and have good lifelong birth memories because they use skills. And that the next generation, your sons and daughters, know that it is normal and natural to self-learn birth and birth coaching skills in pregnancy and use those skills to work through their baby's birth journey. So after all of this and changing from daylight to nighttime, I've said what I have to say. So pass this on as you can. You matter. Your birth matters. What you say to yourself, what you say to your friends and family, what you say to your sons and daughters matter. Take care. Love you.